Hi, thanks so much for joining us. It means a lot. Hey, everybody, thank you so much for being here. Feel free to add your role, the work that you do, so that we know who's here. We're going to be getting started in just another minute. Alrighty. Awesome, awesome. I know more folks might come in as time goes by, but because I know we always have plenty to talk about when we get together for our learning community sessions, I think I'm going to go ahead and move us along so that we can get started. But again, feel free to change your name on Zoom so you have your role and title in addition to your name, and we'll get started and we can go to the next slide. Awesome. So thank you so much again, everybody, for being here. It's so great to be back. Hope everybody's having a good summer. Here's just a small agenda of what we're going to be trying to focus on today. We've got a packed hour ahead. First, we're going to start with our welcome and some norms. We're going to go to a presentation led by Dr. Julie Yi. We're so honored to have her with us today. Then we're going to have time for a brief Q&A and then go to closing. Next slide. Awesome. Thank you. So a couple of our norms, as always, here at the Project for Adolescent Literacy, we really focus on centering educators. So non-educators are certainly welcome, but we are encouraging non-educators to take a listening stance. If you're here with a company like a curriculum developer, you can join, but we ask for no solicitation of materials. And any reporter friends here, we ask for no reporting without permission from our steering committee. We're encouraging people to be present. We're going to have, different ways to support engagement. We'll be recording the session, so you will not need to record with AI or have a note taker. So we'll remove any note takers, and we're going to decide to record the session this time. And another one of our focuses is what works. So we always inform our work with evidence from the field, including research, teacher experience, and student outcomes. So that's what we try to center as a project and is what we focus on through PAL. Here's a little bit about our steering committee. We represent educators and students, that we work with all over the country. And so it's been an honor. I'm a teacher in the Bronx in New York. We have Dr. Tanae York, who is a principal in Chicago. Rachel is a teacher in California. Kate is an educator, an educational leader in Nevada, and Dr. Julie Bircher Brown is in Vermont and is also an educator leading a lot of secondary education work. So we really started this project a couple years ago now, which is surreal to say. And we've been working with teachers all over the country who want to support striving adolescent readers. And we're creating a space to talk about these important conversations and give educators tools that they can use in their classrooms and beyond, focused on adolescent literacy. And then here's the problem we're working on. We always try to use this data just to center why this work is so important. I don't have to tell anybody here that, the nation's report card, the NAEP, has shown that 8th and 12th grade readers have unfortunately been behind and have been struggling to achieve grade level standards in their reading. And we see that there's been a lot of energy and excitement around supporting elementary readers and bringing the science of reading into elementary schools. But we're still thinking about what we can do to do the same thing for secondary students. And so this is why we focus on this project, to try to get people together, to network, to share best practices, and to work to increase and improve these learning outcomes. And then a little bit more of the data, 2024, we have some more scores and just talking about the urgency of that. And then, thank you, a little bit more about PAL. Like I mentioned, for us, we really believe that all secondary students can, should, and must read on grade level, regardless of low expectations for or biases about the literacy abilities of students. And we really want to figure out what reading practices are working at the middle and high school level as shared by teachers. And so we really keep teachers at the center of our work, and we want to focus on transparency, free and open source materials whenever possible, storytelling, acceleration, equity, access, and real talk and real action. And at the end of our session today, I'm super excited to share what we've been doing lately and how you can get involved. Awesome. So I'm so excited now to introduce our presenter today, Dr. Julia Yee. Dr. Yee is an assistant professor in the Department of Communication Sciences and Disorders in the School of Health and Rehabilitation Sciences. And Dr. Yee's research focuses on adolescent language and literacy, with a particular current attention to school and system level factors that shape the identification and delivery of language and literacy supports for adolescents. Her research is guided by more than a decade of experience as a speech language pathologist. She's just a phenomenal leader who has worked extensively with children and adolescents in schools and urban communities in New York City, in Los Angeles, and in her literacy-focused private practice, and has done amazing work both in schools and now in her research. So I'm so excited and honored to introduce Dr. Julia Yee, who was so generously accepting of our invitation to present today as we really dive into her meta-analysis on word decoding for adolescents and how that can support us in our classroom instruction. So I'll pass it over to you now, Dr. Yee, and thank you again for being here.
Thank you so much, Christina. It is so great to be here. I am a huge fan of the work that you are all doing. I think it's so important, and I just love this grassroots movement. And there are so many of these guiding principles, and just reading all this, I just feel like there are so many similarities that we share in terms of values. And so I'm excited to share about all of that. But before I talk about the science and the meta-analysis, I wanted to share a little bit about myself and my journey, which has been a little bit windy. So as Christina mentioned, I'm an assistant professor, but I actually would never have thought of being in the spaces that I am right now as a researcher, doing research, because I always thought that I would, kind of directly support students in the schools. I loved working in the schools. My first job out of graduate school was working in the KIPP schools in New York City. I did that for 6 years. And I worked the thread throughout was middle school. So that's why I highlighted that in red. So I worked as a speech language pathologist supporting language and literacy, the language and literacy of students with language disorders and challenges in a middle school, or a middle school and another middle school, or a middle school and an elementary school, or a middle school and a high school. And so I worked all 6 years, throughout the 6 years, all of those years were spent in at least one middle school. And it continued when I moved to California, to Los Angeles, where I worked in a couple of middle schools, and I also supported some Head Starts as well. And then around this time, I realized I really want to focus on literacy assessment and intervention, particularly in the area of dyslexia. And so I opened up a private practice specializing in literacy assessment and interventions. And then it was at this point that I realized there are so many systemic barriers and challenges that I could kind of help students one at a time, which I love to do. But I felt like I was coming across so many obstacles and barriers. And honestly, I felt like I had more questions than answers. So I moved back to the East Coast, but this time to the southern part of the East Coast, where I attended UNC Chapel Hill, and I got my PhD, and I completed my postdoctoral fellowship there. And I am here in Boston as an assistant professor and the MGH Institute of Health Professions. So all that to say, I'm going to be talking about researchy stuff, but all of this has been guided and informed by my decade of experience in working in the schools mostly, and supporting students and seeing the gaps. My research vision is to understand the needs of and create effective solutions for adolescents with language and literacy challenges by co-developing solutions with community partners grounded in implementation science frameworks that account for the unique developmental and environmental contexts that adolescents are situated in. And so I wanted to talk about that last part because I think the context that adolescents are situated in are so unique. And I think that we have to consider these environmental and developmental factors when we think about how to support them. So those are kind of the lenses and the frameworks that I come in with when I think about how to support adolescents. So I know that we love the NAEP reading scores, and it's something that we talk probably a lot about, as Christina mentioned in the introduction. But there are some nuances with the NAEP reading assessment that I wanted to talk about. So if we think about this, so this is a graph, and you can see each of these lines represents percentiles. So this top line represents students who had reading scores in the top 90th percentile, meaning these were the top 10% of students who had the highest scores, right? And then we see 75th percentile, then 50th percentile, which is the average, and then 25th percentile and 10th percentile. You'll see that since the start of the NAEP reading assessments, which was 1992 till 2024, which is the most recent, the top 50th percentile of students, those reading scores have not changed much, right? So when we talk about the scores are declining, well, if we compare it actually to the earliest NAEP reading assessments, there actually hasn't been much change. That's significant, at least. So these asterisks tell us if it's a significant difference from the 2024 reading assessment. So, but there is a subgroup of students whose reading scores truly are declining, and these are the students whose reading scores are declining. These are the students who are reading on the 25th percentile, meaning the lowest 25% of students in terms of their reading scores, and then the students who are reading on the 10th percentile. So you see this difference from 237 to 233, and you see that the magnitude of difference is actually greater with the lowest 10th percentile, because their scores decrease from 213 to 204. This difference is also apparent in the last few years. So before the pandemic, till post-pandemic, till now, continues to decline. So who are the students who are the lowest 25th percentile? Right? Those are the students who are going to be seen maybe on an MTISS RTI basis. Those are the students who might have IEPs. Those are the students who may or may not be identified as having a specific learning disability or a language disorder. But again, likely these are students who have foundational reading skills challenges, right? So these are students who need the most supports, who truly, maybe it's the foundational reading skills that are a barrier to them being able to, and maybe that's why we're seeing this decline. So I think it's important for us to think about, because when we think about foundational reading skills, again, the numbers kind of show us that it is a current need. So I'm going to kind of go to the next slide. Okay, so what is the state of adolescent literacy research when it comes to foundational skills and how to support adolescents with foundational skills? So in 2000, the National Reading Panel published their report, right? It was this really famous report, and they came out with these recommendations based on the evidence, and it was this really big meta-analysis. And one of those experts that were on the panel was Dr. Timothy Shanahan, and on this in the National Reading Panel, one of the foci was on phonics. So there's a whole section or a pillar on phonics. And what he said just last year, this is his quote from just last year, was, "We don't know much about how best to teach decoding in grades 2 to 12, and existing data provide little encouragement for teaching such skills at those grades and offer no direction for the best way to structure such instruction if we wanted to provide it anyway." isn't that the truth, right? That's the reality that we're living in, is that we actually don't know a lot about how to support students past mid-elementary grades, because what the National Reading Panel report did was they saw that phonics was effective, but who was studied in these phonics intervention studies? They were mostly elementary school students, and mostly those who were in those early elementary years. So we just don't know a lot about how to support students. And can we assume that things like phonics and phonemic awareness that we know works with the younger students, can we generalize it to middle school and high school students? So that was the question that actually influenced and informed this meta-analysis that was just published earlier this year. And it was funny when Christina, you did the introduction and you said something. One of the tenets, I think, was like, what works? And I was like, yep, what works for teaching word reading to adolescents? That was the question that was burning in my mind. And I was telling Christina before this that I had some colleagues who were amazing, who were crazy enough to follow me on this journey of doing a meta-analysis, because a meta-analysis is a significant and time-consuming undertaking. And so there were actually 10 of us on the team. So you see the co-authors there, in addition to graduate assistants who supported us with some of the coding at UNC Chapel Hill, and also the IHP. And I had some collaborators, co-authors from UNC Chapel Hill and Penn State. So we wanted to understand what works for teaching word reading to adolescents. But before I talk about the meta-analysis, let's talk about what a meta-analysis is. So I love a meta-analysis because it's so helpful in thinking about like what works from a large scale perspective. So, we come across studies here and there, right? That sometimes there might be a curriculum or a program or an intervention that comes out, and they might say, our intervention works. We had an effect size of 0.9, which is very, very, very high. But then another study that studied that same intervention might say, ours wasn't, there were no positive effects. Like, it was an effect size of 0. Like, what do we believe then? Right? So a meta-analysis looks at all the studies that have been conducted on a specific topic. And so it helps us look at things kind of more from a large scale perspective. And I'm going to simplify this like crazy. In the end, what a meta-analysis produces is an average effect size of all the interventions to help us understand, if we were to look at all these multiple studies that looked at the same thing, what are the combined or summary effect. So I love a good meta-analysis for this reason. And so let's talk about what we found. So there were 34 studies that were included. In these 34 studies, there were 37 interventions, and all of these interventions had a majority focus on word reading. This was really important to us because we wanted to ensure that the interventions that we're looking at, had a primary focus on word reading so that we could do a deep dive into the word reading interventions. Because what we often saw in the literature was that there were a lot of multi-component interventions for adolescents, meaning they had in this intervention, there might be reading comprehension and vocabulary and writing and reading fluency and some word reading, right? And it might be like 5 minutes or 10 minutes, a small component of the intervention. And I'm not saying that doesn't work, but we wanted to, again, focus on key ingredients within the word reading interventions that could be supportive or not supportive, or effective or not effective. So all the interventions had a majority focus on word reading. There were over 2,700 participants across all the studies, with a mean grade of 7th grade, and the range was 5th grade to 10th grades. About 67% were eligible for free and reduced price lunch. On average, there were 28% English learners, and on average, 50% had a learning disability. We had 200 effect sizes, meaning 200 outcome measures total, right, that looked at, these were basically the tests that were used to see whether or not the intervention was effective. So we had 200 effects, and the publication years range from 1989 to 2020. So most of these interventions took place in middle schools. The mean duration of intervention was 3 months. The mean number of sessions per week was 5 days, and the mean number of session length was 40 minutes. So we could kind of, conceptualize and think of this as kind of like there were these short interventions that, that took place across 3 months. Again, this is the mean, that perhaps happened, took place in an academic block. So these were the findings, and this is called a forest plot. These are all of the interventions combined by outcome type. So we looked at decoding outcomes, non-word decoding outcomes, reading comprehension outcomes, reading fluency outcomes, spelling outcomes, and this is the summary effect. So this is an average of all of the outcomes. And what we found was that it was generally all of them were effective except for fluency, right? So they were all greater than 0. So basically, what can we take away from this is word reading interventions work. The summary effect size was 0.3. And the way that we would interpret this as is that it's a large effect size, especially for adolescents. If we look at a lot of the adolescent literacy intervention effect sizes that are out there, the median effect size, it doesn't really go past 0.1. It's really hard to see effect sizes beyond 0.1 for adolescent literacy interventions. So this was a really good sign, and we interpreted this as both a significant and large effect size. So this is very promising. Now, another promising, hopeful thing was, remember how I mentioned that our intervention, we only included interventions that focused on word reading, meaning there was not a focus on reading comprehension, right? But what we saw here is that the effect size for decoding and reading comprehension were almost the same. And I think this tells us that there are students who are struggling with reading comprehension simply because they're struggling with non-word reading, or I'm sorry, not non-word reading, because of word reading challenges or decoding challenges. And when there is an intervention that supports their ability to read words, it then, as a byproduct, supports their ability to comprehend the text because now they're able to read. So I think this is really hopeful because it tells us that we can support students' reading comprehension, not all, because there are students who will absolutely need language comprehension and reading comprehension supports, but there are a subgroup of students whose main barrier really is, decoding those foundational reading skills. And if you support it, then it does seem to generalize to reading comprehension. Now let's look at the primary intervention approach. So this was kind of understanding what works. So we basically looked at all 37 interventions and we coded them as being, or categorized them as being as having one primary intervention approach. So we, read through all of the studies and the interventions, and we came up with, so we coded them as being either having a primary focus on morphological instruction, or a primary focus on phonics, primary focus on syllabication, a primary focus on word recognition. And then when we couldn't decide, some of them had multiple things that were pretty well balanced in terms of emphasis. Those were the ones that we coded as as being an integrated or a multi approach. Now, these are the confidence intervals. This is the effect size, the square in the middle. Are you able to see my cursor? Yes. Okay, perfect. Thank you. This is 0, meaning there is basically no effect, right? So this, we want to be as positive as possible. We don't want to go into the negative because actually that tells us that the treatment groups the control groups performed better than the treatment groups, right? Which is almost like it's a harmful or negative intervention. So what do we see from here? What we saw is, first of all, you'll see this word recognition is pretty much like 0, right? This is 0.08, and about half of it is kind of in the negative range. So what do we notice? So what we recommend first, word recognition does not work. So what is word recognition? That was basically whole word teaching students to read whole words, and a lot of the times it was through flashcards or drills. So we've known this for a long time across the board, especially for, when we talk about, elementary school students, it doesn't quite work. For adolescents as well, it doesn't work, right? Just teaching them to memorize words doesn't work because it doesn't generalize to other, we're not teaching them the language structures of words to be able to generalize to other unfamiliar words. So that was one. Another thing that I wanted to point out was syllabication. So this was actually the only primary intervention approach that was significantly different from zero. So we know that this was beyond random chance. The effect size estimate was 0.62, so that was really high. And so syllabication is effective, and it's something that I would, recommend, and we'll talk more about this. Another thing that I wanted to point you to was morphological instruction. Now, if we see the range, it's really wide, right? But some of it, just a small part of it, is in the negative range. The effect size estimate, it was 0.76. So it's not statistically significant from zero. However, if I were a betting person, I would actually put my money on morphological instruction because this range is a feature of a lack of precision that comes from not enough studies. So, and that was the case, right? So morphological instruction actually was the least represented primary intervention approach across a study. So there were only like 6 or 7 studies, I think, that had morphological instruction as a primary intervention approach. So the more we have studies, the more precise this confidence interval will be. And my guess is that it would be significant. If we had more studies, I believe that it would be positive. It would be significantly different from zero. And obviously this range would be much smaller or more precise. The other thing that I wanted to point out was phonics, which we know is effective in teaching early elementary school students. However, for adolescents, it yielded an effect size of 0.13. About a third or a quarter of this range was negative. This was a really precise confidence interval because it was small. So that's not surprising because this was the primary intervention approach that was most frequently represented in the studies. So I wanted to point out that the two things that I think are promising are morphological instruction and syllabication. So first, let's talk about what syllabication is. So syllabication is basically this. It's teaching students to divide a long multisyllabic word into its syllable parts. So in this is an example of what, how syllabication might go in dividing the word syllabication into its syllables. So there are 5 syllables, syllabication, right? Now, there are two ways to teach syllabication. One is a traditional type, which is based on Orton Gillingham. So it basically teaches that there are 6 syllable types. There's a closed syllable, open syllable, vowel, consonant, E, etc. If you could type into the chat if you're familiar with these 6 syllable types, and if you've used it before, that would be amazing. It is pretty commonly used, again, in kind of more traditional and OG Orton Gillingham-based literacy interventions. Seeing one enthusiastic yes from Christina, thank you. I'm familiar with these, and we tried using this before, familiar and used a lot. Very good. It's harder than it looks. Yes, it's harder than it looks because there are very specific ways to teach syllable types, right? So, and basically it's teaching students that there are 6 syllable types. A closed syllable has a consonant at the end, and it produces a short vowel sound, etc. Now, there was one study in their meta-analysis where they taught the 6 syllable types and syllabication as their main approach. This took place over 60 lessons across 6 months, and it yielded small to medium effects. Okay, next, I'm going to talk about the other syllabication approach that came up in the literature. There was a flexible syllabication approach. Now, this instructional approach, they taught that every syllable has one vowel sound, and you could flexibly divide the syllables however you'd like, as long as there's one vowel sound in each syllable. So let's say a student divided this word candle, this would be acceptable. Or if they divided as candle, this would also be acceptable. Now, under the traditional syllabication, we know that for those of you who are familiar, the proper way to divide this using the 6 syllable types would be number 1 or number 2. Do you want to put it, if you could type it into the chat if you're familiar with this? Yep, it would be number 1 because this is considered a consonant LE syllable type. The second syllable is considered a consonant LE syllable type. So we need that consonant, that D, to stick with the LE in order for you to say dull, right? Candle. And this would be considered incorrect. Now, the flexible syllabication didn't really account for this, right? Again, as long as every syllable has one vowel sound, you could divide it however you'd like. They taught this across 4 lessons, and what it yielded was actually large effects. So it took way less time than the traditional one. The traditional one was also, it yielded small to medium effects. So it was positive, but the flexible one had, large effects. So both were effective. Now, in terms of the decision making that we all go through as educators, throughout the day, is this idea of that I wanted to talk about and introduce because I felt like it was so clear to me when I saw this trend, was that we are talking about what works, right? So we talk about effectiveness, we talk about efficacy, which is basically what works in sort of earlier trials, but another concept that I want that is in the literature that I wanted to introduce you to is this idea of efficiency, not just what works, but how much resources did we need to see those effects. And I wanted to introduce this because I think it's really important that we, as educators, the important that work that you're all doing, I wanted to say that you probably are thinking about this, but perhaps you didn't have the language or the concepts for this. And I wanted to validate that, first of all. And I wanted to say that this is a really important factor when we work with the students that we do, because they're not reading just maybe 1 or 2 grade levels behind, right? A lot of the times when I work with my 7th and 8th graders, they were reading on a 2nd or 3rd grade level. They are reading multiple grade levels behind. And so time is not on our side. And we do have to think about time, right? Because we want to be able to close that gap, or as much as possible, as quickly as possible. And so what is efficiency? So this is actually this concept of effectiveness, efficacy, and efficiency is actually borrowed from the healthcare and medical research when we talk about, dosage, right? Like if there's a medicine that's out there, how much medicine do we actually need to give in order to be able to see the results or the effects? So I would say if we're to transfer this if we're to borrow this concept in education, it's this idea of like, what's the input? Basically, what are the resources, money, dosage, or time to see the output or the progress? If we're to look at things just from an effectiveness perspective, both were effective. If we were to think about efficiency as a really important variable, which I believe is a really important factor in our decision making, it's how much time, how much money went into this intervention to get the output, to get the outcomes that we did, right? So I just wanted to, this kind of, the little of a, it's not the main part, but I do think that it's really important for us to consider this because it was so glaring when I saw this, that 4 lessons again versus 60 lessons is a really big deal. It's 1 year versus 1 week. And imagine the growth that could happen after just 1 week when they have this strategy to be able to divide multisyllabic words into syllables and then to be able to generalize that across contexts. I mean, I just feel like I think about the snowball effects of that, and I do think it's an important thing for us to consider. Now let's move on to morphological instruction. So that was the other thing. Again, it had that wide confidence interval range, but again, the median effect size estimate was zero point 0.7, which was high. So what is morphological instruction? You might have heard of this already because I feel like in the past few years, it's really, there have been more conversations around what this is. But morphemes are the smallest unit of meaning in words. So if we're to divide a word into its morphemes in the word syllabication, there are two morphemes. Remember, if we're to divide it by syllables, there are 5 syllables. If we were to divide it by morphemes, there'd be 2 syllables. The first one being syllabicate, which comes from the word syllables, and then shun, which is, it makes the word into a noun or it means the act of. Now that might have helped me, or might have helped a student be able to see that there are these 2 word parts. Now we can add meaning to it. It's basically the act of dividing a word into its syllables. Now, if we think about morphological instruction, it's basically teaching and helping students see that multisyllabic words have multiple morphemes by, let's say, prefixes, base roots, and suffixes. So in this word reconstruction, if we're to divide it into its morphemes, there are 3 morphemes, re, construct, and shun, the prefix being re, the base or root being construct, and then shun being the suffix. And we're not just reading it, now we can talk about the meaning, right? Because all of these have meanings attached to them. So re means again, construct means to build, and shun makes the word into a noun, or it means the act of. So this could all be conversation, right? What do you know? What word parts do you see? First of all, they might say, I see the word re, I see the word construct, I see the word shun. Very good. What do you know about what does re mean? They might say it means again, et cetera. It could be this conversation, discussion, and let's put it all together. What do you think this word means? It means to build again, or the act of building again. Very good. Now we put meaning to it, and we can now talk about, we can now integrate it with the passage or whatever it is that they're reading to help them make sense of the passage. Another thing that I thought it was so funny, Christina, when one of the values is open access free resources. I'm a huge believer in open access free resource, and I love to share good resources whenever I come across them. And these are some of the resources that I share with my students that I wanted to share with you. You might be familiar with this already, but the Iowa Reading Research Center has a morpheme lab. So if you click on that, it'll lead you to their resources. There's also, okay, let's see. I want to try to open this up. Do you all see that? Okay, yep, thank you. So these are morphemes. These are so many resources on morphemes, get out of the University of Iowa. They have a word dissector app, e-learning, morpheme lists, etc. Another thing that I wanted to point out to you is if you're wondering, okay, so there is morphological instruction in terms of helping students as they come across words naturally, but also we could take time to explicitly and systematically teach on morphemes. The question is, what morphemes should you teach, right? Because there's so many morphemes to teach. So someone actually did a study, or a group of researchers actually did this really cool study where they analyzed a bunch of texts by content discipline. So they looked at ELA texts, social studies, science, and math texts, and they basically counted how frequently morphemes came up. And they basically put this into a PDF where we could look at what are the high frequency morphemes by content discipline. So this is for ELA. If you look over here, these are the most frequently occurring prefixes in ELA text. These are the most frequently occurring suffixes, Latin roots and Greek roots. And so this might be a really great way for you to, resource for you to choose which morphemes you want to explicitly teach, because again, efficiency is an important factor in our decision making. And so instead of just kind of arbitrarily choosing whatever morphemes in your instruction, just thinking about it more strategically, these are a list of resources that you could use. There's another resource called the Morphology Project. This is out of Australia, and there were a few speech language pathologists who created this. I actually couldn't find the website right now when I looked just a couple of days ago. But if you look over here, if you click on that, you'll see. How do I click on that? Yep. Okay. That someone actually kind of created. Posted these slides. So they're actually for younger students, but I think it'll help you, it might give you a sense of how to explicitly teach morphemes. So these are slide decks for grade 3, but I think you could use these for older students. So it's kind of like teaching and giving examples and contexts. And again, we want there to be a lot of conversation, discussion, interaction, helping them read, write, spell. We just want to integrate all of these elements. And I think that that the Morphology Project does it pretty well. So this might give you some ideas. I also wanted to introduce you to Word Connections. If you haven't heard of the TOS Lab, Dr. Jessica Tost over at UT Austin, she's done amazing work, and she actually created a curriculum called Word Connections. It's a multisyllabic word reading program. She uses morphological morphemes, and it's an approach to teach multisyllabic words. So you'll see over here the affix banks. So there's like morphemes throughout. There's wordplay, beat the clock. There's writing, there's spelling, there's reading fluency, etc. And it's a 40 lesson program. It's free. It was created for upper elementary students, but again, I think that this is something that could be applied for older students as well. If you click on that, it'll give you free access to the teacher manual and the student materials. So I would highly recommend looking at these resources to be able to support students' morphological awareness. Okay, this is the last thing that I'm going to end with because I am past my time. So another finding, thank you, Christina. The last finding, actually, no, second to last finding would be it's not too late. So a lot of the times in education research, what we see is that the older students get, the smaller the effect sizes, right? And that's just kind of the repeated thing that we found again and again. It was the opposite actually for us in this study. So as the older the students got, first of all, the less studies there were. But for the studies that were there, it actually yielded higher effects. So if you look at sixth graders, you'll see here that sort of like the median part is like a little bit less than 0. By the time they're in 10th grade, the effect size estimate is around 1.5. We did a statistical analysis to see if this trend, this pattern was statistically significant or not, and we found that it was a statistically significant relationship in terms of this upward linear relationship, positive linear relationship between grade and effect size. So basically, the average effect of decoding interventions on outcomes increased by 0.439 standard deviations. When I see this, I get so hopeful because I consider myself a realistic optimist. I have to be realistic about things, but I'm also hopeful in terms of the way that I see data. And when I see this, I think about, why is it that, 8th, 9th, and 10th graders, that their effect sizes are larger than the younger students. And I would say, I think by that age, there might be enough motivation and self-awareness where they realize I really need to work on this, and someone is throwing a lifeline to them in the form of this intervention, and they really grab onto it. That's just the way that I would interpret this. So those are my hopeful, optimistic sort of stance. I think that there are things that we could tap into with those older students in terms of engagement and motivation, because their reasons and their motivation to want to read is maybe stronger with those older students. So this is the last thing that I would want to leave you, I'll leave you with. I think this is a $1 million question based on, 2 years of working on this meta-analysis. This is the one question that I would say that if you could walk away with, this is kind of like the conclusion, right? What word parts do you see? I think is a really powerful, small but really powerful question that you could ask, because that could go lead you down both syllabication and morphological instruction. It helps them to see syllable parts where it might help them to divide a multisyllabic word into the word parts by syllabication perhaps, or by morphemes, and that'll allow you to go into a conversation about morphemes. But whatever that is, it doesn't have to be strict. I think that there's flexibility that's allowed, and I just want to validate that the work that you do as educators is both has to be explicit, but it's good educators are responsive, right? And I feel like this question will allow you to flexibly respond to students as they recognize word parts and allow for those conversations that they come across in text, where they come across a word that they don't know how to read, and it's a strategy that they could use as in their back pocket, right? You could say, whenever you come across a long word and you're not sure where to start, ask yourself, what word parts do you see? And go from there. And obviously, you're going to be teaching them all these other strategies, such as morphological instruction and flexible syllabication, such as there's a one vowel sound per syllable, things like that. But I think that this is simple enough, and I think it's a micro move that could make possibly macro and major changes and supports. So that's it. In terms of the presentation, I'm so sorry that I ran over time.
Do not apologize, Dr. Yi. That was awesome, awesome, awesome. Thank you so much for your amazing presentation and for really showing us both the promise and the possibilities of continuing on the path, for adolescent readers. And it's so cool to see at that one of the last slides about effect size and just some hopeful data, that
Yep.
really is encouraging for all of us as we do the work. So
Right.
it was awesome. So thank you so much. And we're super excited, everybody. We're now opening it up to Q&A. And so we have some time now to have questions for Dr. Yi around her work. We already see, hey, Stephanie, already see we have a question here. Feel free, everyone, to add your questions in the chat, or you can raise a hand. Stephanie asks, can you suggest a morphology book that could be read in a book study? So I wonder, Dr. if you have any favorite books or resources around morphology that would be good for teachers just starting out around a book study
Yeah.
for the school year.
That's a great question. I can't think of anything off the top of my head, but I would recommend the work of Dr. Ken Apple. He's done this work for decades now. And it's mostly kind of in the research sort of literature that he writes, but I believe he actually is coming out with the morphological awareness test. Have you all heard about the morphological awareness test? So it's the first standardized assessment that I know of that really does a deep dive into understanding a student's morphological awareness. And so I would recommend starting with him. I feel like I also might have seen a book, and I might be making this up. Morpheme Matters. I don't know. Is that a book? I have no idea. But I haven't read it myself. But I feel like I've seen that, and I feel like if I like the title, so um, and it might be worth checking out if that was a real book or not. I see your hand up by Rachel.
Go ahead, Rachel.
Hi, Dr. Yi. Thank you so
Hi,
much for this
Rachel.
presentation. It was excellent. I have two really specific questions from
Yes.
your effect size slide. One was when you said that fluency was found to be ineffective, do you mean fluency as in wordless, or did you mean fluency as in connected text passages?
Yes, that's a great question. Um, it was connected text passages. So
Oh,
basically, like,
wow.
yep, words.
Interesting.
Usually, reading fluency is like captured or measured by like reading words correctly per minute.
Right.
And so these were reading fluency measures. Um,
Okay.
so yeah, and it might
That's
be yes,
interesting.
yep,
That's really interesting. And then the other piece was when you said phonics wasn't effective, just question mark, like if there's a student who never got initial instruction in, structured phonics, scope and sequence, change schools many times, XYZ, that student may benefit, like would it, Am I interpreting it right that you're saying like ongoing repeated exposure phonics is not effective, but like initially, like what we want to see in K to 2, if we have a high school student that never really got that instruction, it might be?
I'm so glad that you asked that question because I actually forgot to mention this because I was going to mention that this is a meta-analysis that looks at kind of the big picture, broad picture, right? But I think there are students, and certainly students that I've worked with, that never had the sound symbol,
Right.
they were never taught that the sound for A is ah, or the sound for
Exactly.
TH is. So I do think that I don't think we should overgeneralize it as every student needs it,
Right.
but I do think we
Right.
should consider it as it could be potentially that some students need it. And I probably wouldn't recommend, and these are just my thoughts, and there isn't a ton of research on this, but I would say with adolescents, I don't think we need to start with A apple A. I think we can do assessments that look to see what those gaps are and provide targeted interventions to do just
Yep.
those sound symbols where they have a
Right.
gap. Because
Right.
again, efficiency. Because the thing about scope and
Right.
sequence sometimes is that we start all the way from the very beginning, and
Exactly.
first of all, it could be demoralizing to the student. And so there are things there that we want to prevent, that we want to support in terms of from a strengths-based perspective, but also thinking about it from a time perspective as well. Perhaps not starting from the base, ground zero, but kind of starting from what are the gaps that they in
Right.
terms of their sound symbol knowledge, and just targeting those things. That is such a great question,
Thank you
Rachel.
so much for clarifying both of those. I appreciate it.
Yes, of course.
Awesome. Thank you for that question, Rachel, for sure. And I'll say too, we have time for some additional questions. Melissa, I see you're in the chat. You asked, I'm in the process of developing my acceleration class for sixth graders, largely based on morphology, work, and
I
simplification. So I'm
love
glad
it.
I'm here. Great timing. My question is that I have a handful of students that are coming up with 90 minutes of pull-out instruction. I generally keep them in the regular ed classroom, but support the full-time and plan present actively with the ELA teacher. Which model is best practice for these lower functioning, striving readers, these students?
Oh, that's such a great question. So you have 90 minutes to work with them in a pull-out setting during ELA, right? I think it really depends on the students and what their needs are. The interesting thing about this study is that the mean the mean intervention duration was only 3 months. And I didn't talk about this because of time, but there was a statistical analysis that we did to see if intervention duration, like longer intervention duration, was linked to higher effects. And we found that there was no relationship. So I actually think that for word reading interventions, it doesn't have to be forever, right? It could just be super targeted, a few months. Again, the average was 5 days a week for 45 minutes, across 3 months. And I think that so I would say, thinking about like, what are their needs? How can I explicitly teach morphological instruction? It doesn't have to be a lot of time, I don't think, based on what the data tells us. Maybe it's twice a week that work with them, and then the other times they go into the ELA classroom. I think that the important thing is collaboration, though. Like if we're working with the ELA teacher, I would absolutely make time, no matter what you do, even if you are pulling them out and then because that tier 1 instruction is as important as the tier 2, tier 3, and special ed instruction and pull-out supports and interventions that we provide. So I think it could be hybrid, right? It doesn't have to be like all pull out or all push in. It's like, what does the data tell us about what the students need? And then kind of reflexively adapting the model to them for that year. Because we all know that there are years where there are cohorts that come in and their needs are so different this year compared to last year's, right? And so one of the big things that's happening right now in the science of reading movement is universal screenings for K-3, but we don't have that for middle schools and high schools necessarily, right? There are some schools that might do sort of like some sort of test in the beginning of the year, maybe a map test at the end of the year. But we're not doing a universal screener where we're able to know like what are their needs, what are their grade levels like, what is their phonics or decoding, skills like, what do we, so I think that it could be this, in an ideal world, I would say a universal screener in September, maybe CAP-DSS. If you've never heard of CAP-DSS, I would highly recommend looking into that, because it's a universal screener for adolescents, developed for reading for adolescents, that actually break it down into, I think, 5 different aspects, including morphological instruction. It was created by reading researchers, Dr. Sabatini, and it's great. And I think that could then inform what your students need, and maybe and then creating, determining the model, the classroom model of that year based on that. I don't know if that was super helpful. I'm sorry. I just feel like it really does depend on the needs. Yes, students missing ELA instruction. Yeah. Yeah, I think that we're educators, like all of us who have worked in the schools, we're such creative people, right? Because I feel like when we're tapped for reasons, like when we don't have unlimited resources, we find ways. And so I think that there are ways for us to do this. And I think it requires a level of strategy and intentionality, though, and buy-in from everyone, including ELA teachers. So
Absolutely.
yes, the CAPD assess. Yes.
Awesome. Awesome. Oh my goodness. I know when this group gets together, we always have so much to discuss. So it really means a lot, Dr. Ian. We're so thankful for you answering these questions. I'm just scrolling back up. Maybe we'll have time for one more question before we close. Amanda asks, was there any data on whether intervention works better if it's individual versus small group versus class? Was there anything on that?
That's that's such a great question. We coded for this. And so each code was done by 2 of us on the authorship team. And we then calculated inter-rater reliability. Our inter-rater reliability for some of these codes were so bad because we couldn't figure out when, where, how these interventions were taking place. And it really opened my eyes to how variable interventions are. Because sometimes they'd be like, we went into the computer room to do these interventions, but it wasn't really clear, like in what context, like when. So we don't have what the elementary school students have right now, like win time, like what I need time, like RTI, MTSS time that's integrated into the schedule. I think that we need something like that for our middle schools, at least, because we know that about 1/3 of middle school students are really struggling. They're reading below basic. And so I think that we do need to think about, from a systems perspective, like when, where, how can we be providing these RTI MTSS special ed services? Because right now there are way too many system constraints, I think, because it's not designed for this, for these interventions to take place. And so we actually couldn't run an analysis for that reason, although it would have been amazing to have that analysis. So,
I mean, I just want to laugh because there's another participant, Alexandra, but she and I are doing a reading class. And if you tried to code it for it looks like a class, we run it as small groups. So it's like I'm using the cooking teacher's office. But would you know how many people are actually in my group? You would not. I'm pretty sure our principal doesn't either, but we won't discuss.
Yeah. No, I hear you. And I think that's why we had a really hard time coding. Some of us were using our inferencing skills, but at the end of the day, sometimes we had whole classroom instruction and small group, but it wasn't very clear like when or how often. So Yes.
Thank you. Thank you. Thank you. Thank you. So relatable. How to even code some of these interventions, classes, small group, just trying to fit that work in wherever we can. And, if we could ask one more question for you, Dr. Yu, before we close,
Yes.
Rachel asks, is the flexible syllabification for lesson method available open source anywhere? Or, do you have any resources related to that method particularly?
So that's a really great question. It is so simple that there's no curriculum for it. I think it's literally they just taught. I mean, if you wanted to, I could look for that study and it'll be probably maybe 2 or 3 paragraphs at most that describe it. But what I mentioned was literally what it was, which was teaching them the concept. And it might be just explicit instruction that, every syllable has one vowel sound. And let's see how you can divide it, right? So I think it's more of a strategy than it is an intervention, although they saw it as an intervention because it took place across 4 lessons. But again, I would be happy to go into that study and copy and paste how they described how they described the 4 lessons.
Thank you so much. No worries. That sounds great. Just a few of us in the chat, like rewards, like in some of their posters have, I think, something very similar. That's just like, here's,
Yep.
just a go-to and can certainly be applicable to other work. So with students, regardless of curriculum. So thank
Right,
you
right.
so much. And, if it's all right, Dr. Yi, I'll go ahead. These last few slides I can share on my end just to
Oh,
wrap
yeah.
things up for PAL. And
Yes.
I know, there's so much more to discuss. And excitingly, we have more on the way these next couple weeks. And so the conversations will definitely continue. Let me just make sure everybody can see the screen. I'll just quickly say, because I know we're so thankful to have everybody here. Thank you so much again, Dr. Yu, for presenting today. It was awesome. The meta-analysis, we can definitely drop the link to it, Stephanie. The meta-analysis that this work is based on, but we'll drop that link or email after, but it is available online.
I do have to say there is a paywall.
Yes.
And don't love that. I am actually actively applying for a grant to make it not behind a paywall, but it's thousands of dollars to make it open access. So what I can do is if you email me, I can email it to you. So yes.
Thank you. Such a gift, such a gift. That would be really cool. For folks who are on today, please, feel free to take the opportunity to reach out. It's an opportunity to see the article without the payroll. So thank you, Dr. That'd be awesome. And Amanda, I know you shared another resource on teaching flexible syllabification. That's great. And I'll just close by saying that for phase 3 for PAL, we're focused on our learning community. So we're back online. We're going to have these learning community sessions every couple of weeks. We already have sessions scheduled through to Thanksgiving and to the winter holidays. So please feel free to continue to follow our mailing list and LinkedIn to sign up for these online sessions. We're really focusing on storytelling. We're thinking about ways to share the stories of educators, adolescents, families focused on secondary literacy. So excited to be doing that work and share what we've been hearing from teachers and students across the country and try to plug in the work of adolescent readers and their teachers to larger platforms to continue to advocate. And we're also so excited to share that we've begun this national cohort of Action Accelerator schools in Vermont, in Indiana, in Los Angeles, in Massachusetts, and in the Bronx. So this summer, we've been going into schools, giving professional learning, co-hosting and facilitating professional learning. And what's so cool is we are able to compensate the teachers for participating in this secondary adolescent literacy learning. So it's so cool to go from online to in person through this Action Accelerator. And we're excited to let you know how it goes. And hopefully, fingers crossed, have another cohort next year with even more schools. So please be on the lookout as we share updates about that. We have another learning community session coming up on Monday, August 24th. with Mr. David Lieben and Miss Whitney Weldon. And we'll be focused there on reading comprehension research and how it connects to adolescent literacy classroom instruction. So that'll be another great session. You can scan the QR code or go to that bit.ly link to sign up. So feel free to scan that QR code. We'll also drop it in the chat towards the end. Again, that's August 24th. And we'll also have that on LinkedIn and on our website. Awesome. And thank you, Dr. Yi, for dropping your email. Thank you so much. And then I encourage you to follow us on LinkedIn. Speaking of LinkedIn, we have over 100 followers and we're continuing to grow. We're trying to get out there with videos and best practices and bright spots based on all the work that we've been doing so far. And so LinkedIn is going to be the space where we're hoping that all the teachers that follow us on our mailing list can now go to LinkedIn and start to network and comment and share what works for them across the country. And we're going to be rolling out some video and some interesting content in the next couple of weeks. So we encourage you to follow us on LinkedIn, and that's the QR code for that. I'll also drop that in the chat as well in a moment. And then that's all for us. We encourage you to keep in touch. We have our email, we have our website. This is a project of Seek Common Grounds, and we're continuing to reach out to educators across the country as we expand our project. So we're so thankful for you all joining us today. Please feel free to stick around if you have any lasting questions, but thank you so much again. I'll drop all of these links in the chat, and thank you for joining us and hope to see you at the next session on August 24th. Thank you so much again.